This video discussion is basically about hydrofluoric acid, covering the material in chapters 104 and A32 from Goldfrank's Toxicologic Emergencies. The learning objectives for this session are that you'll be able to describe how hydrofluoric acid, HF, is different from other caustic acids, identify the body parts most commonly burned with HF, and to outline a treatment plan for HF burns, which is to include directions on how, by what process, calcium may be administered. Hydrofluoric acid has several uses, including glass etching, the manufacture of microcircuitry and electrical components. It's found in various metal cleaning products, etc. What makes hydrofluoric acid unique among the corrosive acids is that both components of the acid, the hydrogen ions as well as the anion, contribute significantly to its toxicity. With most acids, it's the H+ that really matters, which will cause local surface injury, burning the tissue it contacts, and there will be some limitation to the depth of injury since the burn forms an S-guard limiting the depth of penetration. HF will cause surface burns like the other acids, although HF is not an especially strong acid from the perspective of how much free hydrogen ions it contributes to the solution. HF penetrates more deeply into the tissue, acting more like alkali burns, which more typically cause progressive penetrating injury. So the fluoride ions penetrate more deeply into tissue, causing additional toxic effects. Fluoride binds to divalent cations like calcium and magnesium, so hypocalcemia and hypomagnesemia may occur. Fluoride also induces release of potassium, and systemic fluoride toxicity can also result in metabolic acidosis. Now we're going to watch a 1-minute 15-second clip from the American Chemical Society summarizing HF.
Hydrogen fluoride, or hydrofluoric acid, when dissolved in water, is one of the nastiest, but also most useful, compounds known to chemistry. Hydrofluoric acid is related to the more common hydrochloric acid found in our stomachs. Early chemists who worked with hydrogen fluoride did so because they were trying to isolate fluorine, one of the most reactive elements. HF can penetrate skin because it's miscible with both water and fat. The hydrogen-fluorine bond is so strong that the molecule stays intact until it reaches deep tissue. There, it dissociates, producing hydrogen ions, also known as acid, and highly reactive free fluoride ions. These fluoride ions wreak havoc on tissues, turning them into viscous goo. They also bind with calcium and other positively charged ions. That causes your nerves to release potassium ions, which you feel as horrible pain. But in an industrial setting with all the proper equipment and safety precautions in place, HF is extremely useful. It's a key ingredient for imparting fluorine atoms into organic molecules, making things like Teflon, refrigerants, and pharmaceuticals. And because it can dissolve glass, it's used to etch the patterns onto silicon wafers, turning them into the chips inside the electronic devices we know and love.
The most frequent way that people get HF burns is from leaks in their gloves. They're using HF for relatively close-up work with their hands, either applying it to etch glass or to clean metal, and they're probably aware that it's dangerous, so they're wearing gloves. If there's a leak in the glove, some HF can get in. And since HF is not a very strong acid, it doesn't necessarily hurt right away, allowing more time for contact and for the HF to begin penetrating deeper into the tissue before the patient notices what's going on. The first thing to do is decontaminate the area, washing and copiously irrigating the area with water, and then to apply calcium, which will bind to and effectively neutralize the fluoride ions, so that they won't continue to progressively penetrate and cause further injury. We start with topical calcium. There's a commercially available 2.5% calcium gluconate gel. And if you don't have the prepared topical gel, there are a few recipes available to make your own. For instance, a 10 cc vial of 10% calcium gluconate mixed with 30 cc's of lubricating jelly will also make a 2.5% gel. And if you applied this early enough after HF exposure, or if the exposure was fairly superficial, that may be all that's needed. Our therapeutic goal here is the resolution of pain. If applying topical calcium resolves the pain, we're done. But if it doesn't, then we need to get more invasive with administering calcium. Deeper HF injuries, which we'd recognize because the patient continues to have pain, may be treated by local injection of calcium gluconate into the skin and subcutaneous tissue. But a major limiting factor here is that there is a very limited volume you can inject into a patient's fingers, and fingertip HF burns are a common location. And the injections themselves can be painful since you have to use a needle, but you can't numb the patient up with local anesthetics first because then you can't monitor the treatment by the clinical endpoint of pain resolution. What's sometimes done in these situations is intra-arterial administration of calcium. As shown here, a catheter can be inserted into the radial artery. This is the same kind of catheter used to continuously monitor blood pressure for critical patients in the ICU. And when you infuse calcium through the arterial line, it will be distributed distally throughout the hand and fingers. Here's a cartoon drawing mnemonic device related to hydrofluoric acid that you might find helpful. Go ahead and pause the video if you want a longer look. Because that's all I have about hydrofluoric acid and antidotal calcium for HF burns. I'll be seeing you around.